So as we all know, that unless you're in the mainstream media, discussions around Joe Biden over the past few days have revolved around him and the allegations levied at him from Tara Reade. But nonetheless, Joe Biden was doing a CNN town hall tonight with Anderson Cooper, with the focus being on this current health crisis that's facing America and indeed the entire world. And on the whole, I was unimpressed with Joe Biden, as I am often unimpressed with Joe Biden. It wasn't his most disastrous interview. We've seen plenty of that, but neither did it give me any confidence that this is the man for the moment. But specifically, he told a whopper of a lie about healthcare, about his plan, and about Medicare for All as represented by Bernie Sanders. I'm going to play you a clip, and in this clip, you'll see Joe Biden basically lie about the fact that his employer-based / choice model is better and cheaper and more effective at dealing with this sort of crisis versus Medicare for All.
Obviously, more than 3 million Americans have filed for unemployment benefits for the first time just last week because of the mass job layoffs. Many also lost their health insurance. Medicare for All would have prevented these kind of disruptions in healthcare coverage. Your plan would preserve employer-based healthcare. I'm wondering, in a case like this, is your plan better than Medicare for All?
Yes, number one, it would be available to everyone. And we provide, the plan I have provides an option, a Medicare option, a public option for Medicare. If you can't afford the health care you had, or you lose it because your employer, you're automatically covered if you'd qualify for Medicaid. And so you would be covered. It can get passed, and it's affordable. It costs a lot of money, but it doesn't cost $35 trillion over 10 years. It costs close to $1 billion. And so my point is that it's the quickest way to make sure we get covered.
So what you just saw there was actually a really excellent question by Anderson Cooper. Whether or not you felt that he held Joe Biden to account on his answer, I don't feel he did. The question is a really good one, and it's the sort of question that I've been raising and that many others have been raising too, which is that in a moment like this, where millions of people, potentially 30% of workers, will find themselves unemployed, maybe only for a few months, maybe longer, when you link insurance to employment, when you link your health care and your dental care and your medicine to your status as an employee with a given company, there is potential chaos looming in the medical system when people lose their jobs. Put another way, it's one more stressor to a person that's already facing a lot of stress in this time. Because in addition to the fact that you lose your job, you don't know when you'll be back, you don't know how you're going to pay for your rent, you don't know how you're going to take care of many of your necessities, you don't know any of these things. You add to that if you happen to get sick, whether it's crisis related or not, you may not be able to afford your coverage. You may not be able to afford the treatment you need. So in addition to losing your job, you've lost the one thing that's keeping you potentially alive or that's keeping you out of medical bankruptcy. It's unjust to link one's health care, which should be a universal human dignity, to their employment status. And Joe Biden and Pete Buttigieg and all the rest have made such a stand on preserving that model. Now, what they'll say is, well, not quite, because we're offering choice for those who don't have that insurance or want something different. We're offering a quote-unquote public option. But in this sort of moment, Joe Biden's system would still utterly fail, because here's the thing. It won't ever be easy or simple or straightforward to just go back and forth between the public option and the employment model. And the fact is that during these sorts of crises, I can guarantee you that if 30% of people find themselves unemployed all at once or over a short period of time, that will cause major logistical headaches for the public option, because millions of people and their spouses and their children and all their dependents are going to register on the plan and expect care, that'll all have to be heavily managed during a time that the rest of the medical system and the governmental systems are bearing a major crisis. Can you imagine right now that in addition to the fact that hospitals and doctors and nurses and public health officials are dealing with this crisis that's overloading the system, that they had to worry about millions of people transitioning from a hodgepodge of employer-based plans onto the public plan with hours or days or weeks notice if you're lucky? How is that going to work? Are people going to be immediately covered? What if they lose their job one day, get sick the next? They didn't have enough time to get onto the public plan. It doesn't work, because here's the simple reality that Anderson Cooper basically hinted at, which is that Medicare for All, a universal, no exceptions, everybody's on it, no matter what, single payer plan would be the very best sort of system. During normal times, of course, but especially in a time like this, no one would have to worry about the costs of a test. No one would have to worry about the treatments needed if they need those treatments. No one. You have cases of people passing away, young, otherwise healthy people, because they realized that they could not afford the treatment even if they needed it. That's under this current model. And if those people had private insurance and then lost their job and couldn't transition onto Joe Biden's mythical choice model in time, the same thing would happen. And again, we have to underline this, that Julian Castro and others have noted multiple times that under the best case estimations of what Biden's plan might look like, 10 million people will not be covered, either by his choice plan or by an insurance plan offered via an employer. So even under Biden's model, the ideal world, 10 million Americans won't have coverage. So in a crisis like this, it would be the same issue. You would have people not getting treatment, putting others at risk, much like the current system allows and is perpetuating. That's under Joe Biden's model. And Bernie Sanders' vision would be the single best way to solve this issue. It's not a guarantee, but it is the best tool you can use to ensure that this sort of crisis has the smallest footprint it possibly can. Everyone's covered in the treatment. Everyone's covered in the testing. No one has to worry about other forms of treatment being done during the same time. And no one has to worry about the crisis of unemployment also being a crisis of healthcare. That's really what's at stake. And Joe Biden, of course, lied when he said that Bernie Sanders' plan would cost $35 trillion, which is a bold-faced lie. And he also lied about the fact that his plan would only cost $1 billion, which is basically a few bucks per American. It's not going to cost that little. In some estimations, the choice-based models that you've seen from the neoliberal Democrats would cost more than Bernie Sanders' model because of all the inefficiencies and the overlaps and the fact that it's still baking in massive profits for private insurance industries. Bernie's vision is the best one in general, but especially for the crisis America faces. Anderson Cooper asked the right questions, although when Joe Biden gave the wrong answers, he failed to hold them to account. But for all those watching, I hope they realized that Biden wasn't convincing, and that when Anderson Cooper said that your choice-based model would fail where Bernie's universal model would succeed, I hope it sways more than a few people.